Hello. Welcome, everyone. Thanks for joining us today. I'm really excited about our topic today, and I'm even more excited about our amazing guest that we have actually had on a few times now. So if you don't recognize her, this is Dr. Betsy Redmond, the scientist with Innovative Pet Labs. If you're new here and you don't know who I am, welcome. I'm Dr. Katie Woodley, the natural pet doctor. I'm an integrative holistic veterinarian who's on a mission to make sure you, as the amazing pet parents, have tools and support to help your pets thrive. So we're going to be talking about the holistic approach to diarrhea in dogs and cats. And so this is a really popular, common topic. It is definitely not a normal condition, but every single person here will deal with diarrhea at some point in their pets' lives. It's inevitable, so we might as well be prepared for it. And then also, too, we're here to give you some tools and support that you can start utilizing for your pets if you're in this situation, or to have it in stock in your pantry. So if it does come up, you are ready, because it usually happens in the middle of the night, on the weekends, and on holidays. And that goes for all of us, including myself as a veterinarian. So, but first, I would love for Dr. Redmond to introduce herself to all the amazing pet parents that are joining us today.
Okay, yeah. And I was going to say, I like your 70s Hall & Oates intro music.
Getting us ready for some diarrhea
talk. You love diarrhea talk. Yeah, I'm Betsy Redmond. I have a PhD in nutrition and a master's, and I worked in functional laboratory testing in the human world for 15 plus years. And I got together with some of my coworkers, and we wanted to test our pets, but you have to have specific pet reference ranges. So, and a lot of the original research was done in pets. So we just started a company. So I'm one of the co-founders of Innovative Pet Lab, and we do stool testing to kind of see what's going on in the gut.
Yes, and I love these tests. We'll be talking more about when you would use them. Don't worry, we're going to talk about too what you should be doing before you even test. And sometimes you don't need these tests. But before, we were kind of flying blind and just assuming or hoping what we were using would work for our pets. And now we have some actual functional medicine diagnostic tests that can help us identify where to actually focus, so you don't end up wasting money, time watching your pet get worse and wondering if what you're doing is actually working. So we'll be talking about that too. But I think a great place to start with, of course, is, what is diarrhea? I think most people know what diarrhea is. It's loose stool. Sometimes you'll see blood, mucus. It can be acute, meaning that it's been going on for a couple days, or it can actually become chronic, where it's going on for weeks, months, and some pets even years. So especially with autoimmune diseases like inflammatory bowel disease, that's definitely something where that is a chronic diarrhea. These tests can also help for either of those conditions and identifying kind of where to focus and how the treatments, whether you're using conventional or a more natural holistic approach, if the treatments you're doing are actually working. Now, we need to talk about too, like, what are some of the causes? There's a lot of causes out there, because whenever we see a symptom, diarrhea is the symptom, we need to be thinking about, why is that symptom there? And it's the same when we're dealing with diarrhea. So there's a lot of different reasons. And the number one reason that I find, and we're going to go through a case study where I believe this was playing a part, is stress. The emotional health can be a huge factor for a lot of dogs and even cats for causing diarrhea. We know that there's the gut-brain axis, the microbiome, so all those beneficial microbes in the gut that are producing, hopefully, things that are like your neurotransmitters like serotonin, tryptophan, and even producing short chain fatty acids that are nurturing the gut lining. If things start getting off and our pets get stressed, that can actually create leaky gut itself and create inflammation in the gut that then shows up as the symptom of diarrhea. So if you have this pet that's like, they kind of seem like they get stressed, and then all of a sudden maybe later on that day or a day or two later, they start having diarrhea, we need to be focusing on how do we support their emotional health. We also know that food allergies and sensitivities can create loose stool and be a problem for a lot of pets. Food allergies are not as common, but food sensitivities, especially with leaky gut condition, can be a huge issue. And then we have dietary issues. This is like your dog gets into the garbage can or eats, the steaks off of the grill, and, the cat goes and eats the stick of butter. That can create diarrhea. Who has been there? I totally have. Our dog once got into the trash, and then, of course, we had diarrhea, and it wasn't fun. So dietary indiscretion, of course, can lead to acute diarrhea. Usually it's self-resolving. It goes away on its own. Poor quality diets can also cause that sudden diet changes. If you're changing over from kibble to a fresh food diet, this can also happen. Parasites, overgrowth of bacteria, viruses. So parvovirus is a big one, especially in dogs. Toxins, pancreatitis, other metabolic disorders, like things like Addison's disease, which can be an adrenal gland issue. A lot of these metabolic disorders are going to fall into the category of a chronic diarrhea state. So it's usually not going to be just a couple days, but if you're noticing your pet's not handling stress well, these are tests that you can do. And also to make sure that your veterinarian is running routine blood work, doing stool tests, all of those things also to make sure we're not missing something, because we want to make sure that we are treating the cause, the reason, the root cause for the diarrhea. So those are a lot of causes, right? There's a lot of things that can create diarrhea. Now, in terms of acute diarrhea, and Dr. Redmond, would you say a lot of people are coming to you for acute diarrhea or more chronic diarrhea, or when do you see a lot of pet parents coming to you for these different diagnostics you run?
Yeah, I say we get the majority of like chronic.
Okay.
Because, I think, like you said, a lot of the reasons, pets get diarrhea are similar to people.
Yeah. I mean,
Sometimes it just wait a day and see. You're not going to like have a pet. Some people might have, one diarrhea and then do the test. But most people it's going to be like, well, this diarrhea is a problem. I need to figure it out. It's not just, they ate something and I got to wait it out. It may be something, a little bit bigger.
yeah, definitely. And this is where like acute diarrhea, this goes with anything we talk about. We always need to assess how our pet is doing. So if they're really lethargic, we are seeing like blood spewing out the back end, the diarrhea is not stopping, you're worried about dehydration, they're not wanting to eat, or you're also seeing a lot of vomiting, we need to take them in and get examined by the vet. So that is always really, really important. Your pet's the best. This goes with dogs, it goes with cats. So always get them examined, because things can go south pretty quickly if they get really dehydrated, and we don't want that to happen. Now, the big thing here when we're talking about like acute diarrhea, so this is like diarrhea has been going on for a couple days. Like Dr. Redmond just talked about, think about yourself. Like we're not running usually to the ER if we have some like loose stool, right? You're like, oh, I got some food poisoning. Usually you're like, let me rest my gut and take it easy. And I'm not going to go eat that like Big Mac. This is not the time to like keep
Well,
feeding
hopefully you're
yourself.
never eating that thing.
I hope so, but, I see some strange things. And a lot of times we end up doing this with our pets without realizing it, where we keep feeding them the same food, or we try offering them and trying to like force feed. And our pets aren't very good at being like, no, thank you, because they can be a little bit primitive, right? And so this is where we want to really rest the gut. Now, here's the thing. I'm going to be talking about on Friday a new drug that just came out. And this is where when we do go to the vet, having these holistic tools in your toolbox and starting to implement them, a lot of times this is going to alleviate the symptoms of diarrhea, reset that gut, get it back into order, and you don't need the drugs. Now, the problem is when you go to the vet, a lot of times they're going to be reaching for a drug called metronidazole. And this drug is used specifically to treat like anaerobic bacteria, Giardia, other protozoa. That's what it's commonly used for. Now, the problem is there's a lot of studies now that show that it actually isn't beneficial for the entire microbiome. So it's kind of like a nuclear war going off, like a bomb going off in the gut. When we give it, we'll actually wipe everything out. And so we can actually create more issues down the road when we use these drugs. And these studies show that a lot of the remedies we're going to talk about, like probiotics, can actually have more benefit and work faster at getting that diarrhea resolved. But there is a new drug that came out, and I did it in quotation because it's a license that it was the first approved licensing of metronidazole for animals. Previously to last week, this drug, this commonly used drug, was used off label. If you want to learn more, make sure you come to our coffee talk on Friday morning, where I'm going to be talking more, breaking down those studies. But you need to be aware of this drug. It's called Diarrhea, and your vet will probably be offering it to you. And this is something to be aware of, because I want you to know what it is. We need to be asking, what is the drug that's in here? Because once again, the tools that we're going to be providing to you today, you can start using, and you shouldn't need this drug most of the time. I would say about 99% of the time, don't need to use metronidazole. It also has a lot of side effects. So to learn more, make sure you come back to our coffee talk on Friday. So
Yeah, I mean, I think that's true with like people, like pets. I guess pets are, that seems to be like the new thing with pets. Just kill everything and then see how
yes.
they do. We already went through it with people.
Yeah, I mean, that's the thing. Like, we need to think about what is the thing that you're using, whether it's a conventional drug, whether it's an herbal remedy, whether it's a supplement. I find we tend to just give things, and we're not thinking about how to actually fix it. It's like, I need to give this, I need to give that. Oh, Sally gave that, and it fixed her dog's diarrhea, or the diarrhea went away. And we're forgetting to ask the why. That's really, really important, and understanding too. That's where like holistic medicine starts getting used like conventional drugs. And we think we're using a holistic approach, but we're just really treating symptoms once again. And we want to shift the way we think about that. So, especially with medications like these antibiotics that may seem like they work right away, they can actually disrupt the microbiome, create health issues down the road. There's studies in humans that have shown just giving metronidazole to humans can actually lead to autoimmune diseases like Crohn's disease, inflammatory bowel disease, atopic dermatitis down the road. So they can come with lasting side effects. Now, I'm not against drugs. That's my disclaimer, not against drugs. There is a time and a place that we need conventional medications. So keep that in mind, but we need to also look at the whole picture. So that leads us to, how would you go about like a holistic support plan for the dog and the cat if we're dealing with diarrhea? So Dr. Redmond, how would you approach that?
How would I approach diarrhea?
Like,
I'm sorry. I
like
was
if
reading
you
one of the things, one of the
we see
comments.
some people that have met Dr. Redmond. So, hey, Brian, it's good to
Somebody
see
has
you.
the comprehensive and hasn't used it. Yeah, they can use it because beside diarrhea, the tests are great for looking at just overall health check. You're
Yes,
doing all these things and you just want to see what's going on. So you
yes,
don't have to wait for
proactive.
diarrhea to use it. So
Yes.
yes, what was the question again? Sorry.
So, in terms of like a holistic approach to supporting a pet with like diarrhea. So, let's say like your dog was having diarrhea. What would you do? Like, how would you go about it?
My dog, well, I think that, I don't know if you know me, you might know that I had Linda, who had a lot of gut issues, and she lived to be 18. But it's like, I always try to figure out what's changed in her environment.
Mhm.
So, has anything changed? Did somebody change her food? Did somebody give her some snacks? I'm always like trying to track down exactly what happened around that. And usually, just like with parenting, I just wait it out and see, like, let me wait a day or two
Yeah.
and see if it resolves on its own without doing anything.
Yeah, that's it. And this is also the reason why I mentioned one of the specific causes of diarrhea is emotional health stress. And so this can come with some of those changes too. So if you just moved house, or your dog was boarded at a boarding facility, or your cat, like you moved the furniture and the cat's like, no, thank you. I don't approve of that. Like, I'm going to go have
Move
diarrhea
it
on
back.
your rug. Like, those types of things that can help you to utilize some of the like the natural remedies that we're going to talk about. But it's also really helpful too, because in the future, you can be more proactive. Like, okay, that really stressed them out last time when I went away and we had a pet sitter. let me like strengthen the gut. Let's calm down the nervous system and really support those adrenal glands. And there's so many great ways we can do that safely. So it hopefully like prevents that from happening in the future. So that's really, really important to, I love that you brought that up is, you know, being aware of what maybe some of these triggers are. One of the other things too, I would think of with that is, you know, does this happen with different types of like food changes or even like different types of treats? Because that can give you an idea. Is there like a food sensitivity that's going on? And if you're seeing that pattern, this is where some of these tests are really helpful to identify that. And make it easier down the road. So you're not just always assuming they're sensitive and then we're limiting their diet, like, you know, continually like limiting the food. And then all of a sudden we're feeding like 3 things for the rest of the animal's life and creating other potential imbalances down the road. So I love that you brought that up. How else would you support your pet if they had diarrhea all of a sudden?
Yeah, I would, I might try some, supplements like I like Saccharomyces boulardii as a just general, and just routine too, keeping routine.
Yep.
So,
That's a great beneficial yeast for anyone who hasn't heard of Saccharomyces boulardii. We use it quite a bit, and it actually has a lot of studies that also show that it works really, really well for resolving diarrhea. So it's definitely one of those for alternative to the drug metronidazole. Reach for your Saccharomyces, have that on hand. Those are part of they sit in my refrigerator and we always have those on hand. And, you know, that way you're prepared for if this does happen. And it works fantastic at supporting the microbiome and not impacting it adversely too, which sometimes we can see flare-ups with different types of probiotics, depending on what's going on in the gut. So your S. boulardii, your Saccharomyces, it's a beneficial yeast. It's used in a lot of like animal biome products when they're restoring the gut. And this is one of the things too, in terms of these are great questions coming in, continue to think about why am I giving something? So the things that we go through today, it's not use all of them. It's about what does my pet actually need to help manage the imbalance that's occurring. So if we have a stressor, we can use Saccharomyces boulardii, we can use a bland diet, but we need to make sure we're adjusting that environment, that ecosystem, or else we're going to be kind of stuck where that's going to be a repeating pattern. So that's how I kind of want people. I always talk about like the foundations of health and like the pillars. It's a great way to make sure we're ticking off those boxes versus just reaching for a supplement because you heard it come out of my mouth. So, you know,
well, and I think also knowing your pet, like I have, 2 dogs. Well, I had 2 dogs that Linda always had gut issues. So I was really on top of monitoring that. But Ollie never really did. So if Ollie had diarrhea, that would be a different thing to me.
yeah.
Um,
Yes,
and I think
definitely.
I was going to say also with the finding the food, I mean, a food allergy, you eat it, your dog would have a reaction pretty quickly. But a sensitivity could be a day or 2 later. So it's not like, well, they ate it yesterday, they seemed fine. It may act differently.
Yeah.
So
And
I
with
think,
cats too, the Saccharomyces can lead to constipation. So this is
mhm.
also where keeping track, if you are dealing, especially with chronic issues. So recently I had a cat patient that has IBD, and we were able to use some of the herbs to calm things down, get the stools normal. And we actually introduced Saccharomyces boulardii, and that set the cat off, and the cat couldn't poop. So this is where, because they were keeping a journal and we only added one thing at a time, we knew that most likely it was related to that new supplement, and that cat does not do well with that supplement. So we didn't continue to give it. So that goes along with like knowing your pets, and each pet is different. Each pet is an individual. You can usually use these supplements on a 12-week-old puppy. A lot of the ones we're going to be talking about is okay to use. So, and Lynn, yes, seniors, they're all different symptoms, different needs, just like people. I'm so different from my husband. Like we're very different beings, and how we, you know, what's going on in our lives and our own health and what we respond to and what we don't respond to. So it's the same for our puppies
Right.
and
And there
our,
was another question about using S. boulardii with other probiotics. And yeah, you can.
you can. And once again, keep in mind if we have something like a small intestinal bacterial overgrowth, sometimes we can see flare-ups. with certain types of probiotics. So this is where I really like using Saccharomyces by itself, because you're less likely to have an issue, especially with acute diarrhea. And there's reasons to use different types of probiotics. If we have a anxiety issue, this is where Bifidobacterium longum has a lot of studies in supporting that gut-brain axis and calming down the nervous system. So that can be really helpful if you have an anxious dog, incorporating that type of probiotic or using a blend that includes that type of species in it. And you'll see those on the label. So it's always important to look at the label. What other inactive ingredients are also part of this? There's a really popular probiotic out there that the strain is nice, but they use Animal Digest, which is a rendered product, and I would never recommend using it because it can actually create adverse problems in the gut long term. So this is why reading the ingredient list is really, really important when you're looking at probiotics. Now, in terms of some of the other things too, because probiotics don't always fix everything. I mean, this is why Animal Biome developed for like fecal transplants and gut restore. So actually taking the whole entire ecosystem of those microbes and putting it back into the gut. So that's also another way of doing things. Now, if we have a lot of bloody diarrhea, we call this damp heat in Chinese medicine. So mucus, blood, irritation, there's straining, there's like inflammation there. There's actually an herb called Coptis, Coptis. You can get Coptis tea pills. It's a Chinese herbal medicine. You can get it online. And what's nice about it is really rich in berberine. And berberine has a lot of antibacterial, anti-inflammatory properties. So it can calm down things if we have like a clostridial overgrowth or toxins that are being produced from the overgrowth or dysbiosis in the microbiome. So that's a really great herb that you use short term because it is very cooling to the gut, to calm things down, get them stopped. So that's something else to take a look at that I use all the time, especially in acute diarrhea situations where there's a lot of mucus, straining, and blood. And I recommend having it in your pantry. Are there any other remedies that you would use as like a holistic support?
I can't think of it.
No worries. I always like to see if there's the other things that maybe I haven't thought of. I find a lot of times, especially for pet parents that are taking their pets in, they're doing a stool test, they see a lot of like clostridial overgrowth or toxins that are being produced, and that's what creates a lot of the inflammation in the gut lining. And this is where we would actually I like using binders. There's different types of binders, but activated charcoal is a really easy one for people to get a hold of no matter where you're at in the world. You can just use the human product, and this will help bind those toxins and remove them so they're not just sitting there circulating around, creating a lot of inflammation in the gut lining. So binders can be very, very powerful. Now, keep in mind, if you're using activated charcoal, it's black. So the stool will be black. So don't freak out if you're like dog, you're like, oh my God, now they're getting worse. The stool's black. I harmed my pet. So that's really important to keep in mind when you're doing that. Some of the other basic ones too, teas. I'm a big fan of using herbal teas. So the teas that we drink, for if you are stressed or you have a stressed pup, I see some anxiety, separation anxiety, stress, dependence, those types of things. This is where I would use chamomile tea. So brew a cup for yourself, because if you're feeling stressed, your pet's also feeling your stress. And then you can put, a half a cup to a cup, depending on your pet's size, into their food. And it's going to calm inflammation. It's going to help provide some anti-anxiety properties too. And most animals some will actually drink it from a bowl. Otherwise, just mixing it in their food. Other teas that I use too would be ginger. If you have some nausea, is a really good one. It is a bit warming. So keep that in mind. If we have a lot of like blood or inflammation, then ginger might not be the best option. But peppermint is another tea that's really cooling and soothing. So if you have any vomiting, also that can be helpful too. A lot of gas, we can use fennel tea. So keep in mind, those herbs are really safe, especially when we're diluting it out and using the tea form of those types of support. And organic if you can. So organic is really, really helpful. What is the best application for activated charcoal? This would be diarrhea in general. It'll help usually clear it up pretty quickly if you're using activated charcoal. So once again, we're using it as a binder to bind toxins that are being produced from overgrowth of bacteria that might be there, like Clostridial overgrowth. And Brian, this is great. What about some pumpkin or slippery elm as a way to support loose stools? Slippery elm and marshmallow are some of my go-tos also. They are what we call a mucilage. So they actually act like a Band-Aid on an inflamed gut lining. So if we have acid reflux or vomiting, it's very soothing for the upper part of the gastrointestinal tract. But also too, if we're having diarrhea, so this is impacting like the lower part of the GI tract, it's going to help soothe and calm down that inflammation. So there's a lot of products out there that combine those together. So once again, look at the label, see what does this herb do? What is it for? Would that benefit my pet for what I'm seeing? But those are great options. Pumpkin, I like butternut squash. It's not as high on what is it? Oh my goodness. Like the carb scale, right? Where it's
The
the
glycemic index.
Thank you, Thank you, Betsy. The glycemic index. So butternut squash will be a little bit more tolerable for pets who are on raw food diets. If they're not used to a lot of carbohydrates and processing a lot of like blood sugar release, that's where cooked butternut squash is a great alternative to pumpkin. If pumpkin's the only thing you have, it can benefit them, can benefit both dogs and cats with diarrhea. So that is definitely something else you can use. Bentonite clay, Meryl, it's great to see you here. That is another type of binder. There's different types of binders that you can use. So I always recommend having something on hand. So that way, if there is diarrhea, you can use that. It's also a great natural detox to use because we're all being exposed to toxins, which can also create diarrhea if we can't get the toxins out. All right. So I think those are some really great options for people. Once again, have these in your pantry because acute diarrhea is usually like an emergency type thing, and we don't know when it's going to happen. And it's usually when your normal vet clinic is closed. So be prepared, be ready, and you will feel a lot less stressed if you have the things on hand and you can stop it more quickly. Now, this is where we can start these first, but if things are just like coming back, we're not getting results, or it's turning into a chronic condition. But also too, like Dr. Redmond mentioned, if we want to just know, like, what is the status of my pet's gut lining and what's going on there? Are they processing the food, or do we need to support them in different ways? These tests can be used as a proactive test. So like once a year, just like annual blood work, you can use it, you can send it in. You don't have to wait for the stool to become like diarrhea to run these tests, because a lot of times we assume everything is okay internally and then it's not. And we're like, oh my God, what happened? It was like one day they were fine, the next day they weren't, but they were creeping along on the spectrum of health. And all of a sudden now we like a different exposure, a different stressor, and that was all the body could tolerate. And now we're seeing the symptoms. So if we can know what's going on ahead of time, that's where these tests can be also utilized as a proactive test. So Dr. Redmond, I'll have you go through some of the amazing tests that you have and kind of like where you would use it for dogs and cats for specific situations, or if pet parents wanted to know more about a specific situation in the gut.
Yeah, and I was going to say, yeah, I think that getting a baseline is probably great to have. So, knowing that this is what they normally have and this is, good levels. And so that if you do test them and it's out of range, even if it's borderline, but maybe not high, but at baseline when they're doing great, they're not normally borderline. So, so the test results, we do 6 specific tests and they're in 3 pairs. And so it'll have normal, borderline, and high, or except secretory IgA has high and low. And so just happened to have this in my living room. So this is this is the comprehensive test. And I think it's best if you want to throw the widest net, or, that's what you can use for like a yearly check. So the things we're going to look at calprotectant and secretory IgA. So those are great markers to look at. Calprotectant's looking at gut inflammation. And you're hoping that that's going to be 0, like you don't have inflammation. So just like in people, calprotectant's going to be associated in pets with IBD. So once you get to a certain level, it could, be strongly associated with IBD. It's just neutrophil or white blood cell infiltration into the gut lining. So you might test your pet and they might be borderline. And that would be kind of unexpected, but it would be that your pet might have some low-lying inflammation that just really doesn't show up. And you just think, oh, so occasionally they get blue stools or occasionally they have something, no big deal, they get over it. But part of it might be that they have this like low simmering inflammation.
Yeah.
So,
Yeah. And I think that's, it's like you mentioned, we want to see these things at normal levels. Like they should be, calprotectin should be at 0. So really, really helpful. Now, what are some of the other tests that you have in specific situations people might use them?
yeah, I mean, I like looking at secretory IgA. So it does, it can be too high or it can be too low. I mean, it's not really too high or too low. It's identifying if it's really, so it's the first line of defense at the gut lining, and it would be more likely to be elevated than calprotectin. So they don't always correlate. There can be different things. So secretory IgA, if it's elevated, may be identifying something's going on. And so it can go up if there's parasites, pathogens, food sensitivities. So if it's really high, you might want to look for those things.
Definitely. I see a lot of my patients with sensitivities where it's high, and then that can clue us into looking at what other tests do we need to run to identify specific, causes for why that is high. So remember, for everyone here, like these are functional medicine tests to look at how that gut lining is functioning, if there is inflammation, if there's anything off. It's very different. We get this a lot. It hasn't come up yet. It's very different than the microbiome test from Animal Biome. They're both stool tests, but they're different. They complement each other beautifully. But the microbiome test is looking at the different types of bacteria. If there's an overgrowth or if we're lacking diversity. This is going to tell us, so IPL's test, Innovative Pet Labs tests, are going to tell us, is there inflammation? Is the immune system, the local immune system in the gut, overreacting, or is it underreacting? And we need to give it a gentle boost. And there's a lot of great adaptogenic herbs we can use. So they complement each other really, really well to give you a really well-rounded picture of what's going on in your pets.
Yeah. So when it's really high, I think, if secretory IgA is high, I'd look for some parasites or pathogen. And sometimes it's going to also be correlated to bacteria. So it likes to, surround all the different bacteria. So I might do a stool test then. And if it's really low, I'd want to support the immune system. I might be thinking that they've had something they've been fighting for a long time. And this is, kind of just, it can't fight it as well as it did. I think that Saccharomyces boulardii is always great with low secretory IgA. I think it's a
Yep.
good place to start.
I like also too using a lot of medicinal mushrooms too for a
Mhm.
nice gentle boost for the immune system. So this is even if you want to add mushrooms into the diet or you want to use a more concentrated like supplemental form of mushrooms. There's a lot of great brands out there now. But those are great options too from a food therapy perspective where we can support the body in the way that it needs. And now we know the body needs it versus assuming and you're giving a ton of different supplements. So this is where it's really helpful at identifying what does my pet's body actually need versus just guessing and trying different things, because there could be something here if we have a lot of also inflammation in that gut lining and calprotectin's really high. We know the immune system is very closely intimately connected, and that's connected to the nervous system, which is also connected to the brain. And so if
Right.
you do have anxiety issues, there's probably something going on at the gut level. So it's not just about giving things like CBD or an anti-anxiety medication. Once again, we're we're kind of putting, water on a fire, but we haven't figured out why the fire is actually there in the first place. So it's one of those things where it can help, but it'll help you identify what your pet truly needs. That's why I really like these tests. Now, talk a little bit more about like the leaky gut test, because leaky gut is a term that's thrown around all the
Right,
time.
right,
And,
yeah. Yeah, and you'll see like leaky gut syndrome's not a real thing, or so okay, well, we'll get into semantics, but
yeah, yeah,
yeah, so it's just permeability. It's in your gut, just like you have a gut brain connection, gut skin connection. Anything that has a mucous membrane can have increased permeability. It's supposed to be tightly bound together, and sometimes that can get loose, especially if there is a lot of inflammation. It just makes it hard for the cells to do all the stuff. The gut, inside the gut, it's your immune system and it's digesting, absorbing food. So if there's a lot of inflammation, that can cause an issue. So you could have leaky gut by itself or with inflammation. So you can do the inflammation and immunity test, and that has calprotectant, which looks for inflammation, or secretory IgA, or you can do the basic gut check and you look at calprotectant and zonulin. So zonulin is a protein. It gets made by the intestinal cells, by the liver. But one of the things it does is it can pull the tight junctions, or things that hold cells together, kind of pull them apart. So if zonulin is really high, so I always go for my thing. If your cells are supposed to be like that, and they're not impermeable, you have things coming and going, but if they get too loose, things are going to come in that you probably didn't want to let in. So your dogs may have something, a large protein that normally couldn't get in, or some kind of molecule that made it in, and they might have an immune reaction to that.
Hmm.
So
Yep. And I love how you now have like the basic gut check,
yeah, I like that.
because the leaky gut I found for especially so talk a little bit about the anti-gliadin IgA and the
Yeah,
difference
so
between
yeah,
the
so
two.
there's the leaky gut test, and that has zonulin and anti-gliadin, but a lot of people aren't feeding their pet gluten. They know it's not going to be there. So it's nice if you look at a huge group, but for an individual, like I'm not feeding my dog gluten, so they're not going to get it. So now you can do the basic gut check where you get zonulin and calprotectant. So if the zonulin's high, you can also see, is there any inflammation?
Yep.
So the anti-gliadin is just looking, are you having an intestinal reaction, which is may or may not be the same as a like a blood draw type thing, reaction to gluten. It's not an allergy, it's not celiac disease, but it is an immune reaction to gluten. But you only have it if you're eating gluten, if your pet's you're serving them gluten.
So I think that's really important too for especially any dog, any cat who is on a kibble diet. That test, even if you were to choose one test, I would do the leaky gut test, because you want to see, is my pet having an immune reaction to the food we're feeding? Because we may not have inflammation at that point, but if that immune system's kind of getting triggered a little bit by the foods we're feeding, and we're feeding that food twice a day, every single day for the life of the pet, things are more likely to break down the road. So you would want to know, is this food ideal for my pet? So once again, it's another great proactive way. You may not see, and you probably wouldn't see any symptoms, because we haven't gotten to the level yet where the body's like, okay, I can't take anymore. Now we're going to break, and we're going to show those symptoms of like diarrhea or itchy skin or ear infections or licking the paws. So that test would be really helpful if you are feeding a kibble diet. Higher carb usually has gluten in it. And keeping in mind too, like wheat, rye, barley, those are all things, if you're using like barley in a homemade meal, this would be a good one to check to see, are we having that reaction? So then you can make appropriate choices so we don't get to the place where our pet breaks and we see symptoms develop. And then the last part, the last one that's a separate one from the comprehensive, the digestion and detox test.
Yeah, so that's going to looks at pancreatic elastase, which the pancreas secretes digestive enzymes. So elastase is an enzyme that digests protein. So part of it's going to be, how much protein they're getting, but it's looked at because it's stable within the stool. So there's some other enzymes and they get degraded really quickly. So elastase can identify, is there any kind of pancreatic issue? Most of the research in dogs, I mean, we don't do those two in cats. We're hoping to, but there's just minimal research on it. So we want to make sure it's all buttoned up. But so like in people, you can have, you know, impaired pancreatic function, slightly impaired. You can have, so it's more of a degree. And in dogs, in the research, it's like they have pancreatitis or they're perfectly good. There's, so I think what we're finding is sometimes the pancreas isn't functioning as well. So, your pet may benefit from some digestive enzymes, or looking at what you're feeding them, and is that kind of stressful. And then the other one we look at is beta glucuronidase, and it's also an enzyme. And so pets mammals make beta glucuronidase. We use it for some beta carotene breakdown stuff, but gut bacteria also make it. So if your pet's beta glucuronidase is really high, they're likely not making all that. So they're likely, it's gut bacterial imbalances there, and the gut bacteria are making a lot. So you want to go in there and try to balance the gut bacteria, maybe building up the good bacteria, crowding out the bad.
So. Yeah, and that would be something where I think I saw Amanda asking about SIBO and overgrowths and things like that. This would be helpful to get an idea. I find a lot of animals do really well with digestive enzymes. It's how well me with gut health issues. Am I back?
Yeah.
Can you hear me okay?
Yeah.
My internet is
I'm
going
never
down.
sure if it's me or somebody else. Yeah.
We're here. So,
but I think beta glucuronidase also, if that's really high, that's when I think maybe I'm going to go check the microbiome.
Yeah.
Maybe I want to see what that balance is.
Yeah. So that's where like your animal biome test, this is where if we have high E. coli or high Clostridial overgrowths, then okay, there's a lot of great ways we can naturally treat that. We don't need to reach for an antibiotic. There's a lot of great natural remedies, but that's where you can use these tests as a starter. And then if we need to identify what else is going on, there's other functional medicine tests that integrate really well together. So I love all those tests. I love that we have those options in terms of being able to take a more proactive approach and not just guess at what we're doing. So that's hopefully really helpful for people. I would love if you are here live and you've used these tests, drop it in the comment. And also too, you'll see scrolling along the bottom of this, you can actually use the code naturalpet25 for 25% off. That code works all the time for those tests. So definitely check those out. And I also saw a comment from Amanda. Innovative Pet Lab works with your veterinarian. So if your veterinarian is not familiar with Innovative Pet Lab, connect the two, because they can actually have a veterinarian account with them. And if they are recommending the test and you have pet insurance and they made a recommendation and it's in their notes, their medical records, the insurance company more than likely will cover it for your pet. So connect the two, because your vet should know about these tests and all the amazing research and things that these amazing people and ladies at Innovative Pet Lab are doing. So definitely connect the two. Now, I wanted to, we have a couple case studies from real live animals that have had their tests done or their stool tested through Innovative Pet Lab. So let me find their little pictures over here.
And I was going to say, Amanda also asked about would C. diff be considered SIBO? And that's just really two separate things.
They're different. Yeah. Yep. They're different.
SIBO is like an overgrowth and a dysbiosis type thing that's kind of out of control. And C. diff is specific Clostridium difficile. So
correct.
Certainly want to see your vet if that's
Yeah. And that's where too your animal biome test can be helpful. And there's there's a lot of factors that come up with that. So definitely work with your veterinarian or find a functional vet to also partner with to help figure out, why is this happening? What is the root cause? Because there's something going on at the microbiome level, the ecosystem also too, that we need to address. And it could also be, there's other factors like the HPA axis, the hormones. Remember, everything is interconnected. So it's not just about the gut. The gut's a part of the body. It's a huge, important part, but there's all sorts of other factors that are playing a part for that immune system and everything else going on. Okay, so this is our first case study, and this is a 7-year-old boxer, Arlo. And so he came to IPL, nothing had changed the family can think of. So that's once again looking for if something has changed in the history. that created the diarrhea. And they feel like the diarrhea came on suddenly, not every time he poops, but 3 out of 4 times. So it's happening quite frequently. He eats an expensive freeze-dried dog food. I don't know what type, but we hear that a lot.
Right.
Does
Dog food. Yeah.
dog food. So freeze-dried is what I look at. Does get lots of snacks from the neighbors. So Dr. Redmond, I'll have you go through kind of what this report looks like and what some of these test results might mean for Arlo.
Yeah, so the first thing I'm looking at is Arlo doesn't have any real calprotectant. So that's, low. So that's in the green. So I'm not looking at anything really serious. Um, and he doesn't have a leaky gut. So doesn't look like there's a lot of increased intestinal permeability with that normal looking zonulin. But what he does have is he has increased secretory IgA. Is that it? I'm sorry, my computer's real tiny. I can see it's red. I think it's increased.
It is.
Yeah. So, so he's reacting to something. So it's not that, so that tells me it's something maybe sooner, not been going on for years. And they're saying it's starting, has just been showing up. And he's having a reaction to gluten. So he's having a pretty good anti-gluten response. So that to me is like, I think he may be getting gluten specifically, and he's reacting to that. Some of that, like I'm seeing, it's good pancreatic function. So all these things like the calpro, no inflammation, the zonulin is, good in no like leaky gut and good pancreatic function. But it could be that the gluten is leading to a change in the secretory IgA. It could also be changing the balance of the gut bacteria. So, number one, like, talking to people, like, number one, don't get any more snacks from your neighbor and try to check their food. It's hard not to give the pet snacks who really wants a snack. Or, find some snacks are good and give them to your neighbor.
Yes, that's what I was going to recommend. Have a separate bag that they can have in their house, that if they're going to give your dog snacks, you can see where like this adds up pretty quickly. And now we're having some symptoms because the body can't handle it anymore. So it gives you an idea looking at this. I love how Dr. Redmond kind of worked through it and what these mean and where to go next. So, I mean, another test that you could do would be the animal biome test to see now. So you have a better idea. But first, like if you were to start with, say, the microbiome test and you did like the gut restore capsules, right? But you didn't remove the gluten from the diet, you're going to stay stuck in a vicious cycle where you're going to still potentially be creating more inflammation in that gut. So now you can see where like starting with one or the other and how they complement each other. And looking at this too, it's like potentially, so removing the gluten, I'd be also looking at maybe we want to, support that gut lining a little bit, just make sure things are stronger. Your probiotics, we talked about the Saccharomyces would be something I'd be reaching for. And, I love medicinal mushrooms. So adding in some of those too can be really, really helpful. And then if you remove so what would be kind of your next steps, Dr. Redmond, if you remove the gluten, when would you retest in a case like this?
Yeah, I would probably I would expect once I made these changes, I would expect to see over the next couple of weeks the resolution, like it would start to get better. And if it started getting, my thing is if you test and make changes and they start getting better and they stay better, you're kind of done until maybe the next year. But if they're not getting better all the way, or there's really no change, then you might want to, try something a little bit different. If you're going to get rid of the gluten in their diet, the different treats, it may be that this didn't, maybe this just had the tipping point suddenly, but maybe you need to do a little bit of time with the Saccharomyces boulardii and the mushrooms and kind of support. And then I may, follow up in say 3 months.
Mm. Another one I'd be looking at too, if we're worried like there's a food sensitivity issue. This was where like an elimination diet or trying a novel protein, if you're doing like a homemade diet, or even there's so many great freeze-dried brands and raw brands and like even like fresh food options that you can find an elimination diet trial that you could do for a short period of time also. So if you were to retest and things aren't moving and you've removed that gluten, and then you've tested the microbiome and it's fine, this is where I'd be looking at potentially an elimination diet trial, or doing other testing. I've talked a lot about NutriScan saliva tests to look for food sensitivities, but even just doing a novel protein diet, picking a protein that your pet's never been exposed to. Rabbit is a really nice one that can work really well. But definitely I'd be looking at that point also. Any final things on Arlo before we move to our next example?
No, I think we're good with Arlo. He's very cute.
He is very cute. Boxers can be prone to a lot of diarrhea and also autoimmune type eosinophilic issues too. So keep that in mind. There could be other things going on with that.
Yeah, I think that's a good point. Like we had a boxer once and we never fed raw, and suddenly like that dog, he had all sorts of problems. So that I just wasn't used to. You might be used to one dog who like never has any issues, and then you get another dog and it's got all the issues.
Yep, definitely. I've been there. So with my animal. I just collect the problem childs. So here we are learning lessons. All right. So our next example is June. So she's a 4-year-old English Golden Retriever, and she moved to a new house 6 months ago. Now she's having diarrhea, less energy. She's losing weight too. And they tried to switch her from home cooked from kibble only. So kind of walk us through some of this, Dr. Redmond.
Yeah, so this seems I don't, not necessarily more alarming, but this is the basic gut check. So you're looking at the calprotectant and the zonulin. So the calprotectant is elevated. So there is, there's an inflammation in the gut lining. And it sounds like it's been going on a long time. So there's things. So this is one that I might go to the vet for this one as opposed to just deal with it on my own, since the calprotectant is elevated. I mean, the zonulin is there. You could try, some gut soothing stuff, changing the protein and retesting in like 3 months, getting the mushrooms kind of thing, and seeing if that helps, getting maybe some anti-inflammatories.
Mm.
So it just depends, I guess, on the weight loss is what would probably get me.
Yeah. And I think this is a good reminder. These tests you're able to do them from home without a vet. So keep that in mind. So this is something that if you are seeing these, and this is what I also really like about IPL, is that there's always the recommendation to go to your vet and work with your vet, because this is telling us something is going on with June and there's an inflammatory process. And we need to make sure, once again, this is a marker. It is not telling us exactly what is going on, and we need to figure out, why is she losing weight? And there's other diagnostic tests that need to be run alongside this. So we need to get a better idea of other factors. There's a lot of great GI panels that you can do, blood work that you can do, abdominal ultrasounds. Now, it doesn't mean you have to go down that path, right? There's things that you can use to help support and calm down inflammation that we've already talked about, in terms of like, slippery elm and using supplements that have L-glutamine and marshmallow root and supporting the microbiome. But also too, it can be really confusing if you're trying to figure this out on your own. So working with a veterinarian or a functional medicine vet can also be helpful for you figuring out what those next steps look like, to make sure that we're not just trying things and once again assuming it's working and we end up with a bigger problem because we didn't address it quickly enough or do additional diagnostics with a veterinarian. So keep that in mind for all of these, and any tests that you do that are at-home tests for your pets. If your veterinarian is more conventionally trained, which a lot of my colleagues are, that's okay. There's a lot of functional medicine doctors, veterinarians that are also helping people online, like what we do too. So reach out to those holistic vets, those integrative vets too, to make sure you are partnering with someone rather than just trying the whole kitchen sink and hoping something works and ending up with a supplement graveyard and a pet that's not getting any better, or even more worse. So
yeah. I was going to say, if you look at research, oftentimes like the veterinary research, if calprotectant's high, like first they'll switch dog foods, then they'll go on antibiotics, then they'll go on like biologics or prednisone. So I think the benefit of getting a more holistic integrative vet is that maybe you don't start with that.
Yeah.
depending on where they are. But
Definitely. It can be really hard, especially when there's chronic health issues or really severe issues. Like Lisa, I know you've been battling like protein losing enteropathy and doing some of the tests. And it's once again, it's the bigger picture of how all of those things come together and those foundations, and working with someone that has experience around that is really like the key piece to that, because there's a lot there. Believe me, I got into this because my husband developed autoimmune disease, IBD. I totally get it. There's a lot of rabbit holes to go into. But I like that, Dr. Redmond, you picked June as an example, because we do see a lot of calprotectin that is higher, and we have to start asking ourselves, why is there inflammation there? And this could be a thing like an external toxin like glyphosates, in the environment, or cleaning products. We're surrounded by a lot of different things. It could be the water we're drinking, heavy metals that are there's a lot of different factors. So that's where it's really helpful to work with someone to help guide you, and get a better idea of where to start, and has a framework rather than just guessing.
right.
um,
And I was going to say, we find this pretty responsive.
yep.
Pets can bring it down. It's not, you don't have to go straight for the big guns right away.
Yes, definitely. This is where too, a lot of times so I use a lot of Chinese herbal medicines. There's other, different types of remedies and holistic modalities that you can use in combination to help resolve inflammation that's like severe, and you're working on those imbalances. So those essentially replace a lot of the drugs, but are working more with the body. Now, once again, we're not against drugs. There's a time and a place. Sometimes you have to use a drug for a period of time to help remove some of the resistance to healing, to allow some of those other natural remedies to work too. That's where that true integrative approach can come together. But it's pretty powerful when we use the right tools and resources, and understand where those imbalances are, how we can help our pets truly thrive and heal the root cause versus just treating a symptom. So any final tidbits, uh,
I
things
don't
that
think
you
I
want to
have any
leave with pet
tidbits. I
parents?
mean, yeah, I mean, I'm protesting. To me, like the more knowledge you can get, so, but I work at a lab, so.
I mean, I'm a big fan. Here's the thing. This is where the integrative approach, coming from the conventional side, then going into the whole world of Chinese medicine. It's so powerful when we bring the two together. And it also helps me as a practitioner to see where the things are off. I can come at it from, your pet has damp heat and we have a spleen qi deficiency and all those like crazy terms we use in Chinese medicine. But it also helps me to know, is this pancreas not really producing those digestive enzymes? Do we have an overgrowth of E. coli in the gut that's creating the acid reflux symptoms? Do we have an overgrowth of Clostridium? Do we have calprotectins really high and we're not addressing the inflammation properly? That's going to help me know that the tools we're using are working for the long term, especially when symptoms do go away. How long do we keep these pets on these supplements? It doesn't have to be a lifelong thing. And that's what's really nice, is that we can come off of that, we can retest. And if things look really, really good, that's where you can use these tests as a proactive approach. And you don't have to keep giving, all the different supplements that really, they add so much cost. They're really helpful when we're using it for the right reason, but they can add up to a lot of money over time. And a lot of times we don't even need to be using a lot of the things I see pet parents using, because we actually healed the body and it doesn't need to be continued. So that's just a reminder for everyone here that utilize these, because I hear all the time, spending so much money, I can't afford that. Or do the test and see, do you actually need it? Because what you're using, you may not actually need, or it might not be helping. So that's always a good reminder that I see over and over again with the pet parents that I work with. All right, perfect. So as a reminder for everyone here, so this was all about like a holistic, integrative approach to managing diarrhea in dogs and cats. You can re-listen to this replay. There's a lot of resources, recommendations from a holistic support using teas and other supplements and using food therapy. So definitely go back and rewatch this. And also to make sure you re-listen to Dr. Redmond explaining when we use the different types of innovative pet lab stool tests. You could order them yourself. Use the code NaturalPet25 for 25% off. You can go to Where do they go, Betsy, for ordering these tests?
Go to innovativepetlab.com.
Super simple. So you can order it directly from there, and get your pets checked. Make sure we're not missing something. Make sure you're on the right path to helping them. And make sure we're using a holistic approach to diarrhea versus just trying to bomb it with antibiotics that can create more health issues down the road. And as a reminder, Friday, we have our next coffee talk with the doc. So I will be talking about the newly licensed metronidazole. So I gave it away there. If you weren't here earlier, but come and learn about that and learn about some of the tests, the studies that they used and what you need to be aware of and be prepared for when you may go to your vet and they may make that recommendation. So join us here. Make sure you like and subscribe so you get notified when we go live at 9 a.m. Mountain Time on Friday for our weekly coffee talk with the doc. And once again, thank you so much, Dr. Redmond, for your time today, and all the work that you do. I know these tests have been really powerful and helpful for the pet parents that I work with and for my own pets. And thank you to all the amazing pet parents for taking time out of your day today. Your time is very valuable. I appreciate you learning more, educating yourself, and most importantly, taking action so that you can help your pets thrive naturally. I'm Dr. Katie Woodley. Until next time. All right. Take care, everyone.